condition that I see pretty regular in the office is an acute Achilles tendon injury or rupture. And traditionally, we obviously see them in our athletes, traditionally basketball and other sports where you can get an eccentric contraction through the Achilles, which can cause it to rupture. But we're also seeing a lot more in the older population who's becoming more and more active. Particularly, one of the sports we see a lot of Achilles tendon injuries is pickleball. And obviously, there's definitely an older generation that is basically putting a lot more strain through their Achilles tendon and can have an increased risk of rupture. That being said, many of these patients wish to remain active, and so the treatment plan to decide whether or not we surgically fix them or we treat them non-operatively is really kind of an in-depth discussion. It's not a 5-minute conversation, and so those can be some of the longer conversations we have in the office about deciding whether or not we should be fixing or not fixing an Achilles tendon. And there's good data to suggest that people do very well with non-operative treatment. We do have more minimally invasive techniques, which are definitely becoming more mainstream with a smaller incision, and I also think it allows us to, rehab them a little bit quicker because the incision's smaller and allow patients to get back sooner to the sports and things that they desire. So when it comes to fixing an Achilles tendon, I use a minimally invasive technique, about a 2-centimeter incision directly overlying the defect. We either use a modified clamp or a jig, basically to allow us to percutaneously thread sutures through the tendon through small poke holes, and then bring those sutures out through the small incision and tie the tendon back together at the appropriate tension, which allows us to do that without having to make a standard open incision. And so in terms of the rehab afterwards, we also get them bearing weight a lot earlier than we used to, usually around 2 weeks after surgery in my practice, which I think is for a quality of life for patients. Having to be non-weight bearing shorter period of time can be super helpful, especially in the older population, where using crutches can be a little bit more challenging. Recovery after Achilles tendon rupture, either surgical or non-surgical, is similar. In my practice, there's a period of non-weight bearing for 2 weeks to allow either the incision heal or the tendon edges to essentially start to scar in at the appropriate length if we're going the non-operative route. And then there's a period of about 6 to 8 weeks of walking in a boot with some wedges that are slowly removed to allow basically the tension to come back on the ankle. Physical therapy started at the 2-week mark, working first on just gentle range of motion and then slowly strengthening and then moving people along. By the time you get to about the 10-week mark, almost the 3-month mark, you're out of the boot in a regular shoe, plus or minus a brace, depending on how the patient's doing, and really then starting to ramp things up. In terms of returns of sports, usually at 6 months for most athletes, I usually let them get back to the sport of their choice. I think, there are definitely, depending on the level of athletic participation, sometimes we wait a little longer. One of my mentors in fellowship used to say, 6 months is fine, 9 months for an insurance policy.